Welcome everyone to tonight's panel. Thank you very much for being here. I'm Colleen Heflin, the Associate Dean of the Maxwell School and Chair and Professor in the Department of Public Administration and International Affairs at Syracuse University, and I'll be moderating tonight's discussion. I want to begin by acknowledging with respect the Onondaga Nation, firekeepers of the Haudenosaunee, the indigenous people on whose ancestral lands Syracuse University now stands. What's at stake is a new series of multidisciplinary panel discussions on recent developments in public policy, and it's organized by Maxwell Center for Policy Research. Tonight's event is the third in the series. For the next hour or so, we'll be discussing the White House Conference on Hunger, Nutrition, and Health that was held at the end of September, just 2 months ago. At this summit, the Biden administration released a national strategy to end hunger and increase healthy eating and physical activity by 2030, so fewer Americans experience diet-related diseases through proposed actions for the administration, Congress, nonprofit, state, local, and tribal partners and communities. The strategy rests on 5 pillars. First, to improve food access and affordability, to end hunger by making it easier for everyone, including individuals in urban, suburban, rural, and tribal communities and territories to access and afford food. The second pillar is to integrate nutrition and health, to prioritize the role of nutrition and food security in overall health, including disease prevention and management, and ensure that our healthcare system addresses the nutrition needs of all people. The third pillar is to empower all consumers to make and have access to healthy choices, to foster environments that enable all people to easily make informed, healthy choices, increase access to healthy food, encourage healthy workplace and school policies, and invest in public education campaigns that are culturally appropriate and resonate with specific communities. The fourth pillar is to support physical activity for all, to make it easier for people to be more physically active, in part by ensuring that everyone has access to safe places to be active, increase awareness of the benefits of physical activity, and to conduct research and measure physical activity. And the final pillar is to enhance nutrition and food security research, to improve nutrition metrics, data collection, and research to inform nutrition and food security policy, particularly on issues of equity, access, and disparities. To provide a little background, I want to start by discussing the current levels of food security in the United States. In 2021, the most recent year for which data is available, 89.8% of US households were food secure throughout the year. The remaining 10.2% of households were food insecure at least sometime during the year, including 3.8%, representing 5.1 million households that had very low food security. Now, the Biden administration has made a commitment to reduce the very low food security group to less than 1% and to cut the number of food insecure households by half. So to reduce it to less than 5%. Food security follows the structures of disadvantage that are consistent throughout society. In 2021, 1 in 3 households living below the poverty line were food insecure. 1 in 4 households headed by single mothers were food insecure. And 1 in 5 Black households and 1 in 6 Hispanic households were food insecure, while only about 1 in 15 white households reported food insecurity. Finally, food insecurity was highest in inner cities, followed by rural areas, and is least common in the suburbs. So here to help us unpack these patterns is an interdisciplinary panel that goes across sociology, agricultural policy, and public affairs. First, Madonna Harrington Meyer is the university professor and professor of sociology. Professor Harrington Meyer's research focuses on U.S. old age policies, grandparenting, and food insecurity in old age. Next, we have Michah Rothbart. Michah is an assistant professor of public administration and international affairs. And Professor Rothbart's research focuses on the intersections between education policy, food policy, and public finance and financial management. And then third, we have Rebecca Schewe, an associate professor of sociology. And her research focuses on the relationship between humans and the natural environment, particularly issues of food and the environment. Each panelist will begin by providing a quick overview of the major issues they see between their area of expertise in the White House Conference on Hunger. And then I'll pose a round of questions for the panelists. Following that, there'll be time for questions from the audience, and I encourage you to enter your questions in the chat box, and we'll get to as many as we can. So starting off with the first round, for the panel, what are the important policy issues raised by the White House Conference in your research area? And Madonna, I'm wondering if you would start out by saying a little bit about how the White House, how the U.S. Department of Agriculture measures food insecurity and how well this works for capturing factors for old age food insecurity.
Good, thank you, Colleen. So this first set of pictures that you're seeing are people waiting in line for free or subsidized food. So if you are food insecure in the United States, this is how you often spend a great deal of your time, waiting in these very, very long lines. The second picture that you're going to see is the official USDA list of questions. Oops, you went too far. List of questions for determining whether you are food insecure. The first 10 questions ask if you run out of money for food, and then 11 through 18 ask questions specifically if there are children in the household. My emphasis today is going to be on food insecurity in old age. So when we think about children in the household in old age, it's grandchildren. They may live there, they may just come after school, they may just come on weekends, but there may be children in the household. But if you look at just the first couple of questions, we worried whether our food would run out before we got money to buy more, or the food that we bought just didn't last and we didn't have money to get more. One of the things we note about this official USDA survey is that every single question links to whether you have enough money for food. In our looking at older adults who are food insecure, we find that there are many factors that make you food insecure that aren't necessarily directly related to money. So I want to look first at the different ways that people get free and subsidized food. There are many, many different ways in the United States. We could give everybody enough SNAP money or enough money to go to the grocery store and buy the food they need. Instead, we give them some money and then we expect them to make use of one of these or maybe all of these 6 different avenues of free and subsidized food. So to begin with, these are combinations of federal, state, and county funded programs. Some are religious organization funded, some are nonprofit funded, and some are funded by user fees. What that means is everywhere you look in the United States, the programs are different. You might live in an area where there is a senior nutrition site right near you, and it might be open 5 days a week. It might serve breakfast, bingo, and lunch, and it might serve really good nutritious food. But you might also live in an area where the closest senior nutrition site is 20 or 30 minutes away. There's no public transportation to get there. The quality of the food isn't very good, and they're only open 2 days a week, or maybe even only 1 day a week. Some senior nutrition sites have what we call a welcome mat. If you come there, they help you get signed up for all kinds of other programs. Others don't provide those kinds of services to help you get connected to other programs. The story is very similar with home delivered meals, which we often call Meals on Wheels. You might be getting wonderful home delivered meals for free or a very small fee, or you might have to pay a fairly large fee. The food can be wonderful and it can be quite untasty and unhealthy. And it might be difficult for people who have any kind of restricted diet due to health concerns to actually eat these meals. The story is very similar for food pantries and delivered food boxes. We saw a lot of delivered food boxes during the pandemic. Food pantries often had to close during the pandemic, and then they would deliver boxes of food to people's houses. Some food pantries are open almost every day of the week. They have long hours. They're right on the bus line. They have lots of fruits and vegetables, and you can go in and choose what you want. Other food pantries are open maybe one day a week. Maybe you're only permitted to come one day a month. Often they run out of food before everyone is served. And often there are pre-collected boxes of food, so you get what you get. And maybe the things you get aren't things you can eat given your health conditions. Maybe you have diabetes or some other factor. You shouldn't be eating salts or fats or preservatives. This situation can be very similar with soup kitchens too. You might live very near one that provides excellent healthy foods, and you might live near one that's only open a couple hours a week, and it might not feel very clean or welcoming. Commodity food giveaways provided a great deal of food, especially during the pandemic. And this story is very similar here as well. You usually wait in a long, long line in a car, and you are given a box of food. They might run out. You might wait hours. You might run out of gas while you're waiting, and you might not have a car to get there in the first place. And also you get what you get. And sometimes, I mean, I've interviewed people who got a 3-gallon bag of chocolate sauce, one who got a 3-gallon bag of spreadable cheese, and one who got granola bars that they just couldn't bring themselves to eat, and one who got a bag of sausage. The entire bag was sausage. So commodity food giveaways are a special category of free and subsidized food distribution that have all the same problems as these others. And finally, farmers market coupons. You can register for a program if you're low income and get vouchers. When you take them to the market, your money is worth usually about 3 times as much as your dollar. This can be wonderful if you have a way to get to the farmer's market and get home from the farmer's market with your produce, and if the farmer's market in your area actually accepts the vouchers. But many people live in an area where they're not accepted. So when we think about the government, oh, can you give me one more slide?
Madonna, I think we'll have to move on and come back. Love to hear more about. Yeah, I know you have a lot more to say in this. We'll definitely come back to you.
Yeah, let's come back to it. Perfect. Thank you.
Yeah. Professor Rothbart, I'm wondering if you could talk a little bit as a public affairs scholar, how you think about policy design and how it shapes the effectiveness of policies intended to address food insecurity.
Yeah, thank you. So I agree. I may think about this national playbook a little differently than some, because my training is in public administration, and that shapes my perspective on its implications. The national strategy document that was released along with the conference is going to have substantial implications, not just on people, but on the institutions and on the practice. And those could then have effects on that could either increase access or unintentionally create barriers to nutritious food. And fundamentally, I also think a lot about who's going to bear the fiscal burden of the various initiatives, the carrots and the sticks that the federal government could use to entice state and local governments and private businesses to get involved, and the additional administrative costs at every level and across institutions that are going to be required to implement these proposals and the expansions effectively. So I want to start with some of the practical considerations for various governmental units involved with scaling up national efforts like these. There's a lot of more and more in this framework, and it's going to cost billions of dollars, but we also need to think about how to thoughtfully manage and share these burdens across levels of government. So for example, how are practitioners going to implement expansions of the SNAP program? And how does the federal government get states and counties on board to help them to simplify application processes and recertification processes to do so? And where are their efforts to expand universal free meals likely to be more effective? And who's going to bear the fiscal burden of lost school lunch and breakfast fees? With pandemic EBT, for example, governments use piecemeal approaches to get funds into different populations. So they use different approaches for populations that are already enrolled in SNAP and those that weren't. And so the question is, are there lessons we can learn from that effort to reach more families with effectively, for example, with summer EBT benefits for children? And as Madonna was alluding to, managing the Older Americans Act nutrition programs also presents a wide array of additional challenges, given the target population could sometimes experience barriers to mobility, internet access, ability to prepare their own meals, and so forth. And so running all these programs and expanding them is going to be expensive, sure, but they also simply are just hard to run. It's not just the direct cost of increased benefits, it's increased administration, it's increased implementation costs too. And so just one example that I'm thinking about in my research is that it's unclear how schools that are already at or near capacity would manage cafeteria kitchens once they offer universal free school meals, because that program is associated with an increase of 5 to 10 percentage point increase in participation in breakfast and lunch each day. And I also want to touch base on implications for participating populations. So governments have large toolkits to make it easier for people to enroll and participate in programs. And some of these are discussed in the strategy, but it's worth drawing them out a bit more here. So one is locational considerations, which are important not just in the macro urban rural regard, but also when thinking about where people are day to day, where they shop, and what foods are more convenient for their schedules. As an example, one of the really important features of the school breakfast program and the National School Lunch Program is that it provides meals, and those are typically warm meals where kids already are during school days. And that's a big deal from the perspective of access, because it greatly reduces the burden of participation for another population that in many cases has independent mobility limitations and limited ability to prepare their own meals. And so even without empirical evidence, there's an intuitive appeal to scaling up features of these programs, but only if it makes participating in the programs more appealing for the children that are facing food insecurity, and especially if the meals are more nutritious than the meals they otherwise would eat. And research suggests both those things are true, but that's where empirical evidence is going to be key as well. And then finally, I also think it's worth noting that governments could do more to link data across programs to make enrollment and recertification processes easier. There's some lessons we could learn from direct certification for school meals for this. And then also testing how changes in policy design and expansions could reduce stigma further, make it easier to participate. The last point I want to make is that if we increase access to these programs, we also need to think about how there are going to be some real barriers that we're presenting. So this might lead to longer lines or less appealing services, which could be the downside of expanded programs. Early or late service times might be needed to reduce bottleneck, but that can make it harder for people to enroll or participate at hours that meet their schedule or during typical meal times. And restricting use of benefits for some of the most convenient options could take the least time for people to prepare might increase participation, but it might be in tension with the nutritional goals of some of the things outlined. And so in practice, implementing any set of these agenda items is going to be really challenging to administer, and taken together, I think it's going to take extensive efforts that are require real attention to detail, both on the public management side and on the implementation side.
Great, thank you. Now to you, Professor Schewe, what's the role of agricultural producers or farmers in the broader mission to end hunger and nutrition-based health disparities?
Yeah, thank you. So I think we're really at a moment when we have the opportunity to priorities in the area of food and agriculture, and to pursue some system level transformation that would support those multiple priorities and stakeholders. With $8 billion dedicated to addressing the problems of our food system, it's an opportunity to look for and support solutions that benefit both consumers who face enormous challenges of food access and nutrition, and producers who face enormous challenges of livelihood and sustainability. I think what's at stake is losing sight of those opportunities of synergy and finding programs and policies that are good for consumers and also good for farmers, farm workers, and the environment. At the same time that millions of Americans face food insecurity and food-related health problems, the people who produce our nation's food also face economic vulnerability, and the natural resources upon which our food system depends face unprecedented challenges, including climate change and other environmental disasters. For example, the National Farmers Union estimates that in 2022, American farmers received only 14.3 cents of every dollar Americans spend on food. The US lost more than 100,000 farms between 2011 and 2018, and farm debt was at an all-time high of over $400 billion in 2021. Farmers face increasingly extreme weather due to climate change and degradation of soil health, water resources, and biodiversity loss threaten the food system in its entirety. We need to prioritize policies and programs that address these system-wide challenges, and remember that food security and food access fundamentally depend upon food being produced in a manner that is sustainable for both the humans who grow our food and the environment. Fortunately, we do have a number of models of programs and policies that serve these multiple priorities. For example, the Senior Farmers Market Nutrition Program that Madonna mentioned is one that helps to provide low-income seniors with access to healthy fruits and vegetables, while also giving farmers access to a larger share of food dollars and supporting diverse agricultural production in local markets. Similar programs support WIC-eligible families to buy eligible foods from farmers and farm markets. Many farmers markets, including our own here in Central New York, now accept SNAP EBT, and some states are supporting use of SNAP benefits for purchasing farm shares or community-supported agriculture. Most of these programs are currently quite small, both in terms of the number of food insecure families and individuals they serve, and in the range of options that are available for farmers to participate. And as previously mentioned, they face very high administrative burdens. So a clear priority area could be to support and expand these existing programs and reduce administrative burdens for both consumers and producers. But there is also a need for more transformative policies that would help make the fundamental changes to our food system that are needed to provide access to healthy and sustainable food. Those transformative policies could include things like incentives and technical support to conventional agricultural producers as they diversify farms to produce healthy fruits and vegetables. We know that diversified production helps create access to local healthy food for consumers and also mitigates financial risks for farmers and supports environmental sustainability. But making that transition is very daunting for farms with high debt loads and who are locked into commodity systems with very little autonomy. It also requires, of course, a different technical skill set and different distribution system. All of that needs support. There's also an opportunity to invest in creating more resilient local and regional food markets. In the US, processed food travels an average of 1,300 miles before it reaches the consumer, and fresh produce travels over 1,500 miles. We glaringly saw during the pandemic how easily these supply chains can be disrupted. Shortening and diversifying agricultural supply chains and reinstituting fair and competitive markets should be a priority to ensure food security and farm sustainability. And then finally, I just want to end by reiterating how important it is to focus on the true problems of food security when we're at this moment of potential transformation. Millions of Americans experience food insecurity at some point each year, but the cause of that food insecurity is not a lack of agricultural production. Rather, the causes are tied to economic and social vulnerability, food distribution, and the type of agricultural production. In fact, many agricultural commodities in the US have problems of overproduction, and somewhere between 30 and 40% of the food produced in the US each year goes to waste. By being clear on the problems of food insecurity and nutrition, we can design programs and policies that support consumers, producers, and the natural environment.
Fantastic. So now that we've outlined what some of the problems are that we need to be considering, I would like each of the panelists now to talk about how this $8 billion in public-private sector commitments should be spent. And Madonna, I'm wondering if you would start out by maybe picking up where you left off by talking about what are the important investments for improving old age food security.
Thank you, Colleen. I think she's going to put that slide back up for me. There we go. So the next slide, perfect, thanks. So Michah has said quite a bit about some of these already, and I want to, instead of talking about all of them, just focus on a few that we maybe haven't addressed quite enough. One of the things that I think is very interesting about the Biden administration's approach is they're saying that we need to start thinking about food and nutrition as a source of medicine, and it goes both ways. If you have better food, you are healthier. But also, if you have better food, your medicine works better, your vaccine works better, your chemo works better, you'll recover from surgery more quickly. So the problems with getting free and subsidized food that's not very healthy, and that's problematic for people who have high blood pressure, who are overweight, who have cholesterol levels that are too high, and who shouldn't be eating processed and salt and fatty foods really starts to show then it starts to be being addressed in this Biden administration approach. So I'm very happy about that. I want to also talk for a minute about administrative burden. We usually think about administrative burden with relationship to SNAP, but there's actually some administrative burden for every one of those types of free and subsidized food that I was mentioning. You have to go to an office and fill out the forms and show that you're poor enough, and then you have to be qualified and gain admission to every one of those programs. So some people said that it just didn't feel worth it to them, especially now that maybe the senior nutrition side is only open once a week. Maybe it's just not worth going down to fill out all the paperwork. We haven't talked at all about budget trade-offs, but one of the things we're seeing in our research with older people who are food insecure is that they have enough money for food because they're doing without so many other things. So yes, we have enough money for food, but we have not gotten our prescriptions this month. We've not gone to the doctor or the dentist this year. We have not been able to put gas in our car or buy clothing. People talked about not having winter coats or boots, doing without basic necessities because the money is being used for rent and food and not for things that are slightly down the pecking order of importance. And I wanted to speak for just a minute also about loneliness and depression. One of the things we're seeing is a lot of people who are older and food insecure live alone, and they find it hard to cook for one. They find it hard to get enough stamina or muster enough energy to cook for one. Sometimes they just don't have good enough health to cook for one. And it's very difficult to prepare a proper meal if you don't have enough energy or good enough health or mobility to do that. And we also are bumping into people who are finding that their isolation isn't growing because they have to decline social invitations. If you don't have enough money that you can make a dish to share at the party, or everybody's going to a restaurant, but you don't have enough to buy your own lunch, then you have to decline. And that can really increase isolation that we're seeing amongst older people who are food insecure.
You're going to end there? Great.
Yeah, I'll end there, Colleen. I mean,
Okay.
what I would say is we should use the money to work on all of those things, all 8 of them. Thank you.
Michah, I wonder if you would talk a little bit about where we should invest to improve childhood food insecurity, looking at the other end of the life course. And I want to encourage individuals to go ahead and put some questions in the chat box.
So this might seem obvious after Madonna spoke and to this audience more generally, but the US does not have a single child food insecurity reduction policy, right? We have SNAP, we have WIC, we have summer EBT, we have the school meals programs. Notably, we actually don't even have a single school meals program. We have the school breakfast program, the national school lunch program, the afternoon snacks component of the school lunch program, and so on. And so this is already a jigsaw puzzle approach, right? Which means that we're constantly plugging holes. And so the way I view this is that I sort of view school breakfast program, national school lunch program as doing a pretty good job for many children during school days. But then nutrition meals on non-school days are often still a problem. And children are only in school about half of days in the year. And so non-school days are as much the norm as school days. And so to my mind, one of the real challenges going forward is going to be to figure out the best way to provide children with nutritious meals, particularly that breakfast and lunch they otherwise would get in school, on days that they're not in school, or for the meals that they're not in school, like dinner, where we don't have that additional benefit of the convenience I was talking about, of them already being in one place. And so I again, will go back to the example of the expanded EBT during COVID. So clearly in that moment, a leading concern was just to get food benefits out to as many families with children as possible. But it seems obvious upon review that some families that already had access to SNAP-like electronic vouchers through the pandemic EBT also had access to the grab and go meals that were made available for pickup at schools and other locations. And so maybe that belt and suspenders strategy made sense then, but it is costly to do this. And it could result in food waste, especially in places like schools, if we're just making the food available for pickup. And then other families conversely didn't have ready access to either of those programs because their travel distances to school or another pickup location might have been too burdensome, or they didn't know how to access the pandemic EBT benefit because they weren't as familiar with the system. And so to me, this experience presents at least two considerations on how we should invest in children's food security. So one are, what are the costs of overlaying sometimes redundant strategies? And are those worth the benefits of making sure that we reduce food insecurity and that everyone can access at least one of these programs? And then also, are there potential inequities that we generate in policy implementation that might disadvantage some populations over another if we use that overlaying strategy? I will note that even that we have only early evidence during from the peak of COVID, there does seem to be pretty good evidence that food insecurity during that period was moderated, especially when you think about the huge spikes in unemployment. And so there's reason to believe that that period we were successful at reducing food insecurity in kids, or at least moderating it, not making it as bad as it could have been, even though kids weren't in school. And then the last thing in terms of investment I want to note is that I am really sensitive to how these changes in public policies are going to affect the institutions that are going to need to run and implement these programs at the federal, state, and local levels. And so the changes to the food programs like this are not just tests of whether USDA is up to the task, but it's also whether all 50 state departments of social services are up to the task, all 50 state departments of education are up to the task, all counties and school districts, et cetera. And I think we all understand that unfunded mandates can be hard for state and local governments or small businesses to adhere to. But we should also remember that even funded programs often require technical assistance and financial support to run well, because these programs can be really hard to manage. And so I'll take another example from school meals of direct certification. So direct certification links administrative record for kids that are already on other anti-poverty programs like SNAP, and makes kids automatically eligible for free school meals. And the process and principle could greatly reduce the cost on families and schools and having to disseminate, fill out, return, chase down, collect school meal eligibility forms. But individual schools or even small school districts really cannot facilitate this process on their own. And even if there's funding incentives for them to do so, they really can't go it alone. They're going to need help from state governments. They're going to need help from local social services agencies and make sure that they're engaged. And only then could those programs have cascading effects, making it easier for kids to participate in meals that might reduce their food insecurity.
Oh, that's great. Thank you. Professor Schewe, I wonder if you would talk about this $8 billion investment in what the opportunities are in terms of farm policy there.
Yeah, thanks. I think there's a lot of opportunities right now. I think there's not a lot of attention in the current draft of the strategy. There's not a lot of discussion about farms and agricultural producers. What is there is some discussion of investment in local and regional food system growth, which I think is a great priority area and should be part of where that $8 billion is spent. That means things like increasing farm to school programs, existing programs, expanding those sort of local and regional support systems that are there. There's a little bit of discussion about improving reducing food waste. I would like to see that again being a higher priority area, given the high rate of food waste that we have in the US. Between 30 and 40% of food produced in the US each year goes to waste. And a large proportion of that is at the retail level, right? So estimates are that about 40% of that is happening at the retail, in the retail sector. That's a policy area that is where the levers can be highly effective to reducing food waste from retailers and getting food from retailers to individuals in need, right? What we don't see in there is much discussion of the monopoly crisis in food and agriculture. There is one mention of the FTC desire to vigorously enforce antitrust laws. Consolidation of monopolies in agricultural and food sector far outstrip any other sector of the United States, and the farmers' share of the food dollar has declined because of that consolidation. That monopoly consolidation is a disadvantage for both producers and for consumers, right? It pushes up food prices and reduces the rate of the farm dollar, or the food dollar that's available to producers. So that's again another sort of key mechanism that I would like to see prioritized in this $8 billion. Of course, I recognize that there's probably not a whole lot of political will to taking action on antitrust and anti-monopoly actions. I'll stop there.
That's great. Thank you, Becky. There's a question for you in the chat. What does the White House plan specifically do to address the glut of low quality, meaning high sugar and processed food in the United States? Is there a plan to cut subsidies for certain types of commodities such as corn, or are there restrictions on how much sugar corporations can add to food? And if not, should there be?
So yes, I will say I'm not a nutritionist, and so this is not sort of my area of expertise, but yes, that is definitely a priority area to create incentives for processors and retailers and other people on the production side to reduce sugar and sodium, in particular in processed foods, is definitely, those incentives are there in the existing program.
Thank you.
As far as the sort of row crop, so just to say on the commodity side of things, there's not a lot of discussion really at all sort of about prioritizing production of different types of commodities from producers, right? So shifting producers towards fruit and vegetable production, that's not really there right now.
That's great. Again, please feel free to put your questions in the chat. A question for you, Professor Rothbart. We've been talking a lot about implications of addressing food insecurity for health policy. Can you speak to the non-health consequences for reaching the goals set by the White House?
Yeah, so to start, I'm going to focus a bit on children, and then we can sort of expand from there and speculate. So intuition suggests food insecurity is going to harm kids beyond their health, right? If you're hungry, it's hard to focus, it's hard to learn, it's hard to behave. And on these fronts, it's worth noting that there's recent empirical evidence that programs like universal free school meals, which are increased participation in the school meals program, also improves student behavior, reduces disciplinary infraction, and also improves test scores. And there's also research that SNAP benefit timing can affect test scores as well, right? Which also suggests that reduced food insecurity, at least around the testing dates, will improve performance. So when we're thinking about the goal of this policy, if we imagine that it now improves our ability to make sure that kids are not food insecure on all days, imagine if they have that focus and that performance accumulated every single day for every child of the year. And another way to think about this is one of the big considerations in education policy is a concern over something called summer learning loss, the idea that students return to school in the fall with fewer skills than they had demonstrated in the spring. And that learning loss derives from many factors, but it certainly seems possible or plausible that at least some of this is driven by the fact that child food insecurity is higher in the summer. And so if we could address child food insecurity in the summer, that might moderate some of these major education policy concerns, like summer learning loss, not just the health concerns about kids going hungry or eating unhealthy foods in the summer. And if we want to take that even a step further, given some of the behavior results from things like the Universal Free School Meals Program literature, perhaps even some of the things we see like increases in crime that's observed in the summer could be moderated as well. So now that we've talked about that for kids, we can sort of expand that further up for adults. If we have evidence from children that if we do policies and programs, implement policies and programs that could reduce food insecurity, that increases their focus, it increases their academic performance, it improves their behavior. It's not far-fetched to imagine that reducing adult food insecurity might improve labor productivity and among any other benefits that could map onto children. I'm less certain of the empirical evidence for adults, but it does seem to me that those mechanisms could be important for that age group as well.
That's great. Comment here in the chat. I think the presentation has reinforced a concern I've had that the food safety net is a patchwork of programs that creates both overlap and gaps. Do you think this federal attention is an opportunity that would be used to create more uniformity? I think of things like your work on the gap between childhood WIC and school meals and the way the SNAP benefits for a child in a household seem unrelated to whether the child gets half of their meals at school or not. Others want to weigh in on
that? Not to be too flippant about it, but I don't think that there was much in this communication and the report that it generated that suggests that there's going to be an effort to create a unified food insecurity program or policy. I think we're going to continue to see a patchwork of programs that sometimes have gaps and sometimes have overlaps. I do think there was a concerted effort and attention to try to at least focus on filling those gaps and making sure that there are fewer gaps in the programs, that people can access the food that they need. The one thing that is noted in it that I think is worth repeating here is that one of those major sources of gaps is that people who enroll for a program for which they're eligible are sometimes eligible for other programs. And we would know this simply by way of them having already enrolled in the first program. And there has not been a lot of work at the federal level to get local governments to and agencies within local governments to speak to each other to try to make sure that enrollment processes are easier to try to fill some of those gaps. I think the exception to this has been in school meals. The direct certification program for school meals was really does take this by design, but there's discussion in the plan to do a better job of doing these across other programs as well. I think taking some of the good lessons learned from direct certification and applying them to other places. So for example, if you're already enrolled in SNAP, that is proof of income eligibility for Head Start or things of that nature. And I think that that's a smart next step to try to at least address some of these gaps.
Yeah, I just want to weigh in on this one because some of my work touches on this. And I think I'm actually really excited about this. I see more energy and discussion at the state level, at the local level between getting programs to talk to each other. And so this has sort of been a well understood problem, this lack of take up in programs. And part of it is getting the data systems to talk. Part of it is streamlining application processes. And so I do think the White House plan helped shine a light on this problem. And I don't think we're going to meet the goals if we don't, in fact, get take up of the existing program, since there aren't new programs coming out of this. We're only going to get there if we have closer to full participation of the safety net that we do have. Becky, I understand that you're getting some questions directly. Would you like to take a favorite?
Sure, I've gotten a couple questions on food waste. So yeah, food waste is addressed to some extent in the existing program as it's outlined. And so we do have a number of existing programs to reduce food waste that are being piloted in states. So New Jersey's had a couple of pretty innovative food waste reduction programs, Wisconsin and Minnesota as well. And those are primarily focused, again, at the retailer level. So getting that 40% of food waste that occurs at the retail level to food distribution centers that already exist. So, yeah.
Madonna, would you say more about the link between transportation and food insecurity and where you think investments should go there?
Sure. I think this is actually a tricky one because people have a car, but they can't drive it because it needs to be inspected and they can't afford the inspection. Or they have a car, but they can't drive it because they can't afford the gas. Or they don't have a car, or there's no public transportation, so it's a really complicated web of issues. One thing I saw during my interviews was that for some people, even though the pandemic was very difficult, we learned some very important lessons during the pandemic, I think. And some people really were better positioned after the pandemic than before because the stimulus checks permitted them to get their car fixed. So maybe their heater got fixed or their brakes got fixed or their tires got changed. So they could actually drive their car now, and they hadn't been able to for quite some time. And so the stimulus checks provided this extra amount of cash that helped some people with cars get back to driving them. But having public transportation that actually works and is effective, that goes to the food pantries, to the farmers markets, and to these other places where you get free and subsidized food would be a big help. If commodity giveaways were held where there is a bus stop, for example, that would be a big help. But it's not the whole story because then you have to carry these heavy things home. So if you're older and you have mobility issues, you don't have the strength, you can't get your groceries up the steps onto the bus, then it can be very difficult to get the groceries home. And so some people are able to get over there, but they can't get back with the groceries once they actually get their hands on the produce or the box of food. And a box of canned food would be very heavy to carry for any of us actually, let alone somebody who's maybe older and has health conditions and has to get up a few steps on the bus. So I do think that spending attention on transportation is very important, but I think it's a complicated set of issues. There's not really a one size fits all solution here. There's a multi-pronged approach is needed, I think.
Thank you. Becky, I'm wondering if you would talk a little bit about what are the implications for rural areas versus urban areas?
Sure. Yeah. Speaking like a rural sociologist. Yeah. So rural food insecurity, as you showed us, Colleen, is an important sort of primary area for food insecurity, right? More than suburban areas for sure. And so depending on how you measure, about 11% of rural households are food insecure. But when you look at the county level, 87% of the counties with high food insecurity are rural counties. And so those rural counties that experience food insecurity have quite different needs than urban areas that address food insecurity, right? So when you think about the transportation issues that Madonna was just raising, that looks really different in a rural area that might have no public transportation infrastructure at all, right? So what does improving transportation look like in a rural area? That's going to look quite different. It's not about expanding a bus system because there might be no bus system, right? We also know that Native American communities would experience really high rates of food insecurity. So for Native American children, the food insecurity rate is projected to be over 34%, right? And so, and then if you expand that to thinking about culturally appropriate food access, those numbers look even worse, right? So rural areas have significant levels of food insecurity and need innovative solutions that are well suited to their rural areas. They might have access to farms, but often those farms are producing row crop agricultural products, not fruits and vegetables and food crops that are sort of well suited for the needs of their community, right? So this is another area in which I think encouraging producers to diversify their agricultural production would really serve rural communities in an important way.
Thanks, that makes a lot of sense. What about the racial equity issue? What do we see in terms of the White House plan in terms of ways of really getting at some of the racial equity issues here? That's open to whoever wants that one.
Well, let me say a few words about this. I'm glad that there's attention. It might not ever be enough attention, but one of the things we're seeing is, food deserts are not everywhere. Food deserts are very much located, usually in poorer parts of inner cities. And there are very often larger populations of Blacks and Hispanics living in areas that have been defined as food deserts. And so a food desert means there aren't really good grocery stores where you can go and buy good produce. And so we interviewed several people who are shopping routinely at the dollar store, and they're buying items that are at their expiration date, and that's where they're getting their food because it's all that's in their neighborhood. So making sure that people have a decent grocery store in their neighborhood that has fresh produce that is affordably priced would be a big addition, and especially if they would attend to areas that are food deserts. So that's one thing that I think about it.
I also think one of the real challenges and that is really highlighted in this plan is to think about the trade-offs between food and healthy food. And some of the biggest gaps we see in health across races is on issues around obesity, right? So people have food insecurity, and they consume high calorie foods that are not necessarily healthy, and it could lead to other types of health problems. And so one of the nice features of this, I do think, is trying to bring these things together, that this isn't just a anti-hunger program or an anti-hunger goal, but it's about nutrition more broadly. And so if food deserts are one issue we're worried about, we're also worried about, so-called food swamps, right? Areas that have a lot of very unhealthy food options in right on top of each other. And thinking about ways to give people education and knowledge to understand the trade-offs between consuming those foods, even though maybe they're more convenient and maybe tastier, but that they might have negative health consequences. I think that's a part of this plan as well. And it's a challenge that I think is not sort of laid out as a racial equity challenge, but I do think it's an important part of the consideration. If you think about where fast food places locate, for example, they're also not locating equally across neighborhoods as well.
Yeah, it's interesting. I have a little bit different take on that one. I think I definitely, I study food as medicine and the connection between food and health, but I want to make sure that we're not being paternalistic and trying to sort of monitor what some populations eat, while we don't necessarily give that same attention to other populations. And so particularly because I think I understand the cultural importance of food and celebrations and sharing. And so I worry a little bit that if we take the joy out of food and start policing food a little bit, that we're changing the fundamental nature. So food as medicine, which is some of the language people are using as one of the pillars of the White House plan, I feel a little caution towards personally, but understanding that it's a very complex issue. So in the time that's remaining, I'm wondering if we could just go around the panel one more time and give a succinct answer to the question. So, what does this all add up to? How optimistic are you that the White House conference is really going to lead to real progress in the area of hunger, nutrition, and health? And maybe we'll go backwards, and we'll start with Becky on this one.
Sure. Maybe I'm naive. I'm optimistic. I think, frankly, it's just exciting to see these conversations happening, right? It's just exciting to see real serious conversations at the federal level about how to support changes to our food and agriculture system. I don't think that the strategy goes far enough. And I don't think it's inclusive of the production side of the system enough, right? I would love to see it really talking about the agro-food system, ag and food intertwined as one inherent system. But I think that there's a lot of potential right now for these conversations to happen that haven't happened in a really long time. So I'm optimistic.
That's great. Michah?
Yeah, I share a lot of Becky's perspective on this. I think it is important to have a sort of roadmap, even if you're going to have to deviate from it as you're actually implementing this in the real world. And so I think bringing attention to these things and importantly, not just for our research agenda, but more broadly, Pillar 5, focusing on making sure that identifying what's working and what isn't, and then adapting to that. I think that's a really important consideration. I think it's something that has informed some of the suggestions in this plan, is that they've looked at what the empirical research is showing, and they've tried to address them, not all, but some of the findings. And I think building that into the plan is going to be really important as well.
Fantastic. Madonna?
I'll make it unanimous. I'm going to say that I'm optimistic as well. I think for me, what matters most is not that we spend a ton of time trying to connect this incredibly complex hodgepodge of programs, but that we try to simplify and streamline the entire process. And what I would want to say is it would be nice if we made it more user-friendly. When you find out how much time and energy and gas and money people are spending making use of this complex system of free and subsidized food, it really is sort of heartbreaking to find out that you can either afford to get to the food bank or you can afford some groceries, but you can't really afford to do both. And so if we could make it more user-friendly and simplified, and if we could reduce how much variation there is, you know, from whether you're in a rich school district or a poor school district, in a rural area or an urban area or an inner city area, the amount of inequality that is linked to those variations is really heartbreaking as well. So for me, those are the big criteria.
Fantastic. I got to give my 2 cents here. I love the boldness and the clarity of this goal. We have benchmarks we need to meet by 2030, and there's a lot of political risk at saying that so clearly. And so I think there's a lot at stake here, and I'm going to be watching with great interest. So thank you all for joining this conversation. I thought this was great fun. Thank you all.